Case number 2 is a 19-year-old patient who presented with cough, fever, and shortness of breath. He was on moderate respiratory distress and on 4 liters of oxygen. On physical examination, there are diffuse crackles throughout both lungs. His laboratory investigations revealed an elevated white count with normal hemoglobin and platelets. Here's what his chest radiograph looked like. There are bilateral, multifocal, peripheral-based opacifications or consolidations, and these findings are typical of COVID-19 pneumonia. Here are some typical as well as atypical and very atypical findings of COVID-19 pneumonia. Typical findings which makes them more likely to be COVID include multifocal ground glass opacification or consolidation that are distributed in a peripheral and basal distribution, meaning that they're located at the edges of the lung and at the lung bases typically. There are associated vascular thickening or congestion, and there can be a crazy paving pattern, which we'll discuss in the following slide. The atypical findings which may point away from COVID-19 pneumonia include central or peribronchial vascular distribution, meaning that these occur more in the medial aspect of the lung parenchyma and adjacent to the pulmonary bronchiovascular structures, or they can occur in a apical distribution, meaning that they occur in the apex of the lungs. The very atypical findings, which strongly point away from COVID-19 pneumonia, include cavitation or calcification, tree and bud nodules, pulmonary masses, or pleural thickening. Here's an example of a typical chest radiograph, and similar to our patient, you can see that there are peripheral and basal predominant consolidations within both lungs. Here are some typical CT findings of COVID-19 pneumonia. You can get this ground glass opacification, which is an area of increased attenuation or increased density of the lung fields on CT. You can get this crazy paving pattern, which represent thickened interlobular lines consisting of dilated pulmonary interstitium and dilated pulmonary lymphatic vessels with interspersed ground glass opacification within the thickened interlobular lines. You can get something called vascular dilation or congestion. Notice in the normal lung parenchyma, there are very thin pulmonary vessels that are almost pencil thin. And take a look at the abnormal pulmonary parenchyma with ground glass opacification. The vessels in the area of abnormal lung parenchyma appears quite dilated in contrast to the normal pulmonary vessels. Here's an example of traction bronchiectasis. This is dilated smaller airways, usually the bronchi or bronchioles, in response to underlying inflammation and scarring. So this is case number 2, COVID-19 pneumonia.